Alright, so I started a new treatment plan today. So instead of recording another digital minimalism vlog, which takes me a wee bit longer to do, when I say wee bit, a lot longer, I'm just gonna do a little health update because I have a lot to tell you. So it is absolutely beautiful outside today. You can see a little bit of it here. Hopefully the wind isn't hitting my mic too much, but it is so beautiful out. And so I wanted to do this vlog outside. Yeah, there's just been so much going on health-wise. And so I wanted to give you a bit of a health update because I've seen a rheumatologist twice now. So the background is on, I believe it was March 3rd, I started having joint pain in every joint in my body. My hands started feeling horrible, my neck, my back, my bottom limbs. Like it was just like something turned on in my body all at once. I can't even click my fingers because that hurts. But it was like something had just turned on in my body that was autoimmune. I assumed it was rheumatoid arthritis because I have arthritis all over in my family, and so it just seemed like, okay, this must be rheumatoid arthritis because of the joint pain. So I ended up calling around, and the rheumatologist that I was first recommended to go to was going to be a year to get in to see them. And I was like, you know what? I need answers sooner. And so thankfully someone else recommended another rheumatologist who I got in to see so much faster. And in the meantime, before I even got in to see them, I went to see my hematologist, and they were like, okay, let's run some blood work just to see what might be going on. I had an elevated ANA at that time. And the staining pattern for the ANA, and ANA basically means that you have inflammation, some sort of autoimmune thing going on. The staining pattern can tell them specifically what's going on sometimes. And at that point, my staining pattern was nucleolar, which points more to scleroderma, which is very interesting. The thing is, I have the symptoms of like everything because I have so many symptoms. I don't just have joint pain, right? Like I've had chronic illness and had new symptoms since I was 14, so for almost 13 years now. We ended up, getting all that blood work. Then we saw the rheumatologist, and she was like, this ANA is not really elevated enough to worry me yet. She was like, I'm gonna do a bunch more blood work though. We're gonna do some x-rays. We're gonna see what's going on. So that was 2 weeks. So 2 weeks after my first ANA test, I got additional blood work, and my ANA had elevated very quickly. So the initial one had a 180 titer, and the second one had a 1320 titer. So it had gone from like the rheumatologist being like, we don't even consider that to be positive, to like, okay, it actually is very positive now. It's much higher, and this means something is going on. Sorry, I'm getting hot flash. So if you see me all, it's because of my hot flash. Literally within 2 weeks, oh, bless you, Aurora. Aurora is out here in her carrier with me because she just screams at the door even if the screen is on. She wants to be out here in a cage. I don't know why. So, sorry, feeling a little sick. The ANA was much more elevated within 2 weeks. And the staining pattern was different. It was no longer nucleolar. I hope I'm pronouncing that right. It was nuclear homogeneous. That's confusing and different. That was pretty much the only test that came back weird. All the other tests came back normal, and she did a lot of tests. She did $4,000 worth of tests. Thank God I have insurance right now that covers it, although I'm paying up the wazoo for my insurance every month, but that's a whole other thing. We thankfully got all the blood work done. Bless you, Aurora. But that was really the only thing that came back weird. However, on my x-rays, they found osteoarthritis in both of my shoulders. Now, I have been having shoulder pain for a while. My right shoulder has been my bad shoulder for probably over a decade now. I've gone to PT for it. I've done a whole bunch of stuff. Nothing has helped it. And so last year I had a shoulder impingement in my right shoulder, and I was having similar symptoms now since the joint pain started, of just like not being able to lift my, like this hurts. Lifting my shoulder to this degree hurts. Lifting it forwards, not too bad. I cannot lift it backwards. Like, it was giving the same as a shoulder impingement. Even before we got the results of the x-ray, she wanted me to start PT for my shoulders because she thought I had a double shoulder impingement, which I still might, I don't know. But last year they saw the shoulder impingement on the x-ray, and they didn't mention, the radiologist did not mention a shoulder impingement this time. They only mentioned the osteoarthritis. So yeah, double osteoarthritis in both shoulders. Thankfully it's mild so far, But it just sucks because osteoarthritis is like a wear and tear disease. The wind is kicking up, so I really hope it's not messing up my audio. But basically osteoarthritis is a wear and tear disease. So most people get it in like their 50s or later. Like my mom has osteoarthritis in her hands, but she didn't start having symptoms until her 50s or 60s. It's just a really frustrating thing, and to have it in both shoulders, it's just not great. Yeah, you can't really come back from osteoarthritis. So that just sucks. That was like not devastating news, but it wasn't great, right? So the rheumatologist said, you know, I don't think that your shoulder pain right now is from the osteoarthritis. Here comes the wind again. But she still wanted me to get PT because she thought that something else was going on with my shoulder. So I will be starting PT for my shoulders. I just finished PT, pelvic floor PT, this week, and in a week or two I'm going to be starting PT for my shoulders. It's a lot of PT because I'm only able to do like one thing a day with my chronic fatigue, and so that's the thing I do that day. And if I have to do that, she said 2 to 3 times a week, that eats up my week because I take a day for my vlog, to record my vlog, to edit my vlog, and then I have mental health therapy one day a week and other doctor's appointment. Like that sucks up my entire week. So goodbye to everything for the next, you know, 2 months or something. I don't know. So that is just not great because I've been doing a lot of PT, and while it can help, it's just a lot of work, and I just don't have the capacity to deal with that right now. But anyway, I'm coming to PT near you soon. So that was one side of it, was starting physical therapy for the osteoarthritis and shoulder pain I'm having. My rheumatologist said it's not clear cut what autoimmune condition. She said, you know, it seems like some sort of autoimmune condition is happening. It's not clear cut right now which autoimmune condition. I believe she suspects Sjogren's because she wants me to get a lip biopsy. And when I say lip biopsy, my parents were like, oh, that sounds super simple. I think it'll be fine. And I was like, no, I think it sounds a little more intense. And when I Googled it, it's more intense. You get 3 to 4 stitches after they cut out your skin on your inner like lip here. So I'm having that, and I think it was like 2 months before I could even get in to be seen for that, to have that procedure done. When she wrote the script for that, she didn't say that to us, but the rheumatologist did say suspects Sjogren's syndrome. I don't have the stereotypical dry eyes, dry mouth. In fact, my mouth has too much saliva. But my eye doctor, when I went to see someone at the beginning of this year, she did say I had slightly dry eyes. So I don't know. We're exploring Sjogren's. I have a lot of the symptoms of lupus, and so what we're going to do in addition to the lip biopsy is we're going to start me on a steroid. I'm starting prednisone today. In fact, I already started it this morning. That was the one thing I really did not want to do, was go on steroids, because there's so many side effects from them, you know, weight gain, moon face. So if I start gaining a lot of weight or just having water retention in my face, it's the steroid, which just sucks. You know, it can really upset your stomach, can affect your sleep. It makes you super immunocompromised. So my immune system has already been pretty wacky, and we've had to be super careful with COVID and just getting sick with anything. Like I cannot afford to get sick with something that could give me long-term effects like long COVID. And now I'm on an immunosuppressor. That is what prednisone is, unfortunately. And so we're gonna do a test and see for potentially the short term. I'm starting on a higher dose, and then we kind of go down in the dose just to see if it helps my joint pain. I mean, potentially could even help my chronic fatigue and my brain fog if this was kind of like a lupus type thing. And so that is a test in and of itself, is to see how my body reacts to a steroid, to prednisone. I'm really nervous for this, so if anyone has been on a steroid before or been on prednisone, like I react to everything. I've just figured out, and I'll probably do a whole video on this maybe, that betaine, HCI I think it is, which I was taking for my low stomach acid and for my acid reflux, and it was helping my acid reflux. I wasn't throwing up in my mouth as much when I was bending over, when I was burping, and I'm like pretty sure, because I've done all these tests on it now, that that was causing me to throw up. I threw up like a month ago after my dad's birthday, then I almost threw up about 2 weeks ago, I almost threw up again yesterday, just horrible car sickness. And so I've been doing all these little tests to see if it's the betaine, and I am 95% sure that the betaine is causing me to be super nauseous, throw up, get very car sick. Yesterday was really bad in the car. I didn't take any today, and I feel so much better. My stomach is not iffy and on the edge of like making me feel nauseous or vomiting. Like It's just so frustrating. So I react not only to medications, but to supplements that most people do not have any problem with. And so that makes me incredibly nervous. So those are the tests we're doing now. Another something that's very exciting, and I can't wait to update you all on it, is that one of my doctors found subheratic or something dermatitis on my scalp. My scalp has been itchy for probably 7 years now. I've been to an allergist, I've been to a dermatologist. Nobody figured this out. And I started doing the medicated shampoo, and then I also have to put a steroid on my scalp, which is so frustrating. There's too many steroids going through my body right now. But literally just starting the medicated shampoo, my scalp felt so much less itchy. So I'm like so grateful to this doctor. If I could get rid of just one issue like my skin itchiness, that could drastically improve the quality of my life, because I get so itchy. Like if I scratch my scalp, usually it would just like erupt in super itchiness where I could not hold myself back from scratching it. My mom would have to like hold my hands being like, you need to stop. Oh, my stomach really hurts right now. I'm so nervous. Like every new thing my body's going through today, I'm like, oh my God, is that the prednisone? Is that a side effect from the prednisone? So anyway, I'm incredibly excited to update you all on that like scalp journey, and hopefully helping my skin itchiness and my skin issues. Like that has been such a journey and nobody's been able to figure it out. And if this was a problem all along, like how life-changing would that be? It would be incredible. Because I'm on 4 meds right now for my skin itchiness. I'm on 2 Benadryl a night, and then 1 prescription med for my skin and my itchiness, and then an Allegra. 4 medications. Way too many. I don't want to be on that for the rest of my life. And if we could figure this out and I could go down off of some of those, that would be incredible. So there's so much going on with my health right now. I'm so excited to continue to update you all. I'm going to the POTS clinic at Johns Hopkins in May and try to get some clarity on if I have POTS or not, because I have chronic fatigue syndrome and that presents differently with POTS. So I've been tested for POTS without the knowledge of chronic fatigue syndrome in there, and the research shows that you have to test differently for POTS if you have chronic fatigue syndrome. So I'm really excited to go there. I'm gonna see some chronic fatigue specialists soon and get more information on that, because I've not been diagnosed by a specialist, just PCPs over the years. And so yeah, I'm so excited. Like there's so many things in the works for my health right now, and hopefully something will come together. And I also have a couple other treatments that I need to push off because of this prednisone. So once this is done, then I can start those other treatments, and I want to tell you about that journey as well, because there's just a lot going on with my body, but I cannot start more than one thing at once, because then we don't know if I get side effects what it's from, and then I have to start it all over again. It's just a nightmare. So I will keep you all updated. Please send good vibes. Really nervous about this steroid, and again, if you have any experience with it or any tips or tricks or things to look out for, please let me know, comment below, and I will keep you updated. I hope you are enjoying the beautiful spring weather that we have been having, and I will be back soon with more in the digital minimalism series, and I can't wait to talk to you all soon, my friends. All right. Bye.